Hello, my name is Steve Christensen, and I am on the YO Committee. I'm joined here with Shahzad Mian, who is currently the Residency Program Director at the University of Michigan, and was formerly a Cornea Fellowship Director also at the University of Michigan. Dr. Mian, you've seen a lot of residents go through your program and seen them progress and develop as people and as physicians. What's your overall vision for training residents?
Well, the overall goal for residency is clinical training. So our goal is for you to certainly gain the medical knowledge and the clinical skill set to be able to provide care to patients. We also want to sort of have you develop areas of focus through scholarly pursuits and be really important, engaged members of the community. And that community is your program itself, your department, your university, the city you're living in. And that's a critical component to learning to be a physician.
And how can the relationships that residents have with their co-residents really enhance their training experience and allow for further collaboration beyond residency?
So one thing that I've learned over the years as a program director is that your relationship with your residents is actually the most important component of what you learn from residency. These are the people who share everything that you're going through the most. They understand what you're going through. But all too often, you can easily feel isolated even though you're working with a group of people who are going through in the same setting, same circumstances. So I think good communication and also being able to share those experiences with your classmates is very, very important. And that really means getting to know them better. It certainly includes just knowing them at work, but really getting to know them more than that. These are the people you're going to be friends with and colleagues with for the rest of your life, which is far longer than the 3 years of residency training. And so this can involve really being there for them when they need some help with call coverage, or if they need some help taking care of their child, or they need some help studying and you have some tools or tips that help somebody get through their BCS books for cornea, for example. I think it's those small acts of kindness that help build relationships and trust that really help build relationships for life.
That's great. And finally, what recommendations do you have for residents in terms of the operating room experience and how they can be ready to attack the next challenge, either in fellowship or in their first job, beyond just the individual instruments that they're using and so forth?
Good question. So I think residency certainly is the place where you learn how to learn. You learn how to do surgery, learn the knowledge you need to be able to take care of patients. But this is really about a lifetime of learning. And it's about learning how to learn over these 3 years. But there is one thing that I think is really important for residents to realize, and not everybody always thinks about it, is that we're so focused, for example, when we're doing surgery on the handpiece that we're using for cataract surgery and have this tunnel vision underneath the microscope that we forget how to actually turn on the machine, how to prime the tubing, how to change the settings. And because we rely on these amazing staff members or sometimes faculty who are helping you do that. But when you're done with your residency, you are the captain of the ship. You are responsible for everything that happens. Even if your technician is trained, the patient's not going to come to the technician and say, hey, what happened to that machine during the surgery? So make sure you spend a little bit of time before you leave focusing on the equipment that you use so that you know how to properly use it at the basic level.
These are fantastic recommendations. Thank you, Dr. Mian, for your time.